Is it visible?
Yes, sir.
This is the person, Swiss mathematician and physicist Daniel Bernoulli. He was born in 1700. So what he described is an increase in the speed of a fluid, which can be a gas, a liquid. So they are all called as fluid. So it is all laws which are used in fluid dynamics occur simultaneously with a decrease in pressure or a decrease in fluid's potential energy. So this is how an aeroplane is able to float in the air because of the two different pressures between these high velocity airflow and low velocity airflow. And based on this principle only, Venturi designed this. Even though it is written as Giovanni Battista Venturi, it is Ani Battista Venturi. That is how it is. It is an Italian physicist who determined a short constriction in the tube between two longer tapered portions that are usually unequal length but terminate with the same diameter. There is a drop in pressure in fluid flowing through the constriction, which may be used to determine the rate of flow or used as a source of suction. This is what Venturi described, and this is what happens. You can see this is a tube which suddenly becomes narrower and then expands. So fluid coming from this at a high velocity, there is a drop in pressure at this point, and that can be used to entrain gas or fluid and increase the volumes. You can see the small arrows here suddenly becoming bigger because of the entrainment. So that is what he described. And again, another, it's a law of conservation of energy. It is based on the law of conservation energy. Flowing liquid possesses two types of energy, potential and kinetic. And there's a constriction in the tube, there is a increase in kinetic energy, and there is a fall in potential energy. And that is what happened, which was described. And Venturi made use of this principle by creating a hole at the constricted portion so that it can cause entrainment. And the applications are, first and foremost, is Venturi mask. All of you will be very familiar with that. Color-coded adapters. These holes here, these gaps here are the ones which will gradually increase to determine the amount of entrainment. So based on that, you can increase the percentage from 24% to maximum you can go up to 60% with the color coded attachment. So it has to be fixed here, and then the oxygen source has to be adapted. And this is again the picture which shows how the entrainment happens. Then there is a Sanders jet injector used during bronchoscopy. So this is the equipment that most of you, I don't know whether you have seen or not, used in the ENT theaters or in the pulmonology department. And this is how this needle here, what is shown here, has to be attached to the bronchoscope here. And there is a control lever. There is a source of gas or oxygen coming at a high pressure. And once you inject this through that, air is entrained through this gap here. And the volume goes in, which can be used to ventilate the patient during surgery. And it is used in nebulizers also. So you can see this is the compressed air coming from that, coming out through a small constriction, and there is a deflector which breaks the fluid into small particles which are becoming like an aerosol in that. And all of you will be familiar with this. So there is this is the folder for the drug. This is the gas attachment. This is how the mask is fixed into the patient. Then it is used in scavenging systems also. The modern anesthesia machine, this is the scavenging outline structure which is there. And it is used in Pethick test to check the integrity of the circuit. This is one of the applications you have to mention in your answer. And set for a low oxygen flow meter. So how you do the Pethick test is commonly asked in the examination to identify the integrity of vein circuit. And you can see if the bag is full, that means the inner tube is damaged. Only when the bag collapses, it indicates that the inner tube is intact. So activate the oxygen flux, observe the bag. The Venturi effect caused by the high flow of oxygen at the patient head will create a negative pressure in the outer tube. and the bag deflates. That is the answer that you have to give. So basic test, how you do, you must be able to explain in the exam. And use in portable suction, Venturi tube as an ejector. Here in the Sanders it is an injector, whereas in the portable suction is used as an ejector, and you can see the mechanism how it is working. And this is the picture of a portable suction that sometimes you will be using in the ward or ICU. Then there is high frequency jet ventilation in tracheal stenosis surgery. This is another important application where you can use this, where you can't intubate the patient in tracheal stenosis surgery. A catheter is passed into the trachea, and you can see this is the flow of oxygen and the control valve mechanism. So this will entrain the gases, and then the very small tidal volumes with a very high frequency will keep the oxygenation going on with an immobile or an uninterfered way of ventilation in this patient. So this is called subglottic jet ventilation, and this is called transtracheal. In a tracheostomized patient also you can do this type of ventilation. And the eighth is modern anesthesia ventilators. It is used as a intermittent blower, and the example of that is pneumopack and Penlon Napil ventilators. Again, this is the mechanism. Then for historical interest sake, there is a spray called the Rowbotham spray. It was used by this person called Stanley Rowbotham, who was a very popular anesthesiologist who worked with Sir Ivan McGill and Harold Gillis, plastic surgeon, during the Second World War. These three people did a lot of challenging work on the maintenance of airway and anesthetizing. He has given local anesthesia for more than 5,000 thyroidectomies, done successfully without intubation. And this is the thing, this is the local anesthetic cocaine containing container, which is activated by the BP bulb, and that creates a positive pressure which causes, there's a hole here to entrain air, and the whole spray will go to the trachea and anesthetize the patient. So this was one of the things that were done in the period. So that is the thing about Venturi. Okay, so can remember the additional points. What you have not mentioned is about the high frequency jet ventilation, Pethick's test, and Rowbotham spray. That you have to add. Okay, right. Who's the